And Navya, you can just check that it's, it is going live. And yeah, and I'll start the recording also so that this can be viewed later on for everyone. Okay. So, good evening, everyone, and welcome to this very important topic and webinar on sleep. I'm Archana Sharma. I'm the founder of Samvedna Care. It gives me immense pleasure to share with you that today Samvedna has turned 10 years. We started our operations on 26th October 10 years ago. Since our inception, we have worked extensively in promoting early detection and diagnosis of mental health issues. Our mission has been to encourage help-seeking behavior and help reduce the stigma around mental health. Samvedna is today a leading technology-enabled organization offering expert-led services to address various mental health and well-being issues in adult population. We have excellent geriatric mental health programs, which we have been offering to our customers in Gurgaon, Delhi, NCR, and now I'm very proud to say that we are offering these services pan-India through our online platform. Our technology-enabled care solutions are person-centric and they are evidence-based and focusing on the overall well-being of the individual and the family, which is also a part of his or her ecosystem. So without wasting any further time, I would like to welcome my distinguished guest speaker today. He's also on our clinical advisory board, Dr. Vipul Rastogi. He's renowned neuropsychiatrist. He's done his higher specialization in psychiatry from UK. He's an FRCS. And also I have my co-founder, Dr. Jayashree Das Gupta. She's a neuropsychologist and a clinical psychologist by education and qualification. She's an Atlantic Fellow in Brain Health. So, as I mentioned, in our promotional mailers as well, a good night's sleep can be a privilege for many. And since we rolled out this webinar, we have got so many questions. We have got questions from students, parents, businessmen that they are finding it difficult to sleep, and they have multiple challenges. And I hope that Dr. Vipul, you will be able to address all of these questions today. So research has shown that lack of good quality sleep can increase risk of cardiovascular diseases, diabetes, as well as blood pressure, obesity, and of course, it's also an indication of probably, an onset of some mental health issues like depression. So today we are here to understand and take some tips back with us on what constitutes a good night's sleep and how it impacts our body and what we can do to have a better sleep. So, Dr. Vipul, I would like to, I'll hand it over to you. And if, you could just start by explaining that what are the different stages of sleep and what really happens in a sleep cycle that will help us understand our Apple Watches also, which we're monitoring every day. I frankly don't understand what those mean.
So first of all, thank you for having me here, and many, many congratulations for completing 10 years. Look, sleep should be coming naturally to everybody, right? It should not be a chore, it should not feel bothersome, and that is the main problem. Sleep is an automatic thing. When people say, I try to sleep, that is the time when the sleep disappears. There was a recent study done about 10 years ago, and they compared the sleeping hours of people in America. So in 1940, average adult in America slept for about 8 hours. And in 2010, it reduced to 6 hours. So what human beings have done recently or over the 60 years, they have given up on 25% of their sleep. We have been, human beings have been around for 10,000 or how so many years. But whatever evolution could not do, we skipped sleep. We try to push away sleep with whatever is happening in our lives, and we've reduced it by 25%. It is bound to affect us somewhere. Sleep principally is restorative. So whatever energy we have spent, we tend to build up that energy when we sleep. It is also a time for healing of the body. So the body repairs ourselves itself when we sleep. When people are sleeping less or not sleeping properly, that restoration function or that repair function does not work well. And that can have an impact both on physical health, but also on mental health. You spoke about some of the things that can happen in the physical body. In the mental health side of things, people can be depressed, irritable, anxious, diagnosis of ADHD, lack of concentration. So all those things multiply. Furthermore, what happens is that people then resort to things like alcohol, things or sleeping tablets to get some sleep, and that causes its own set of problems. So sleep should be beautiful, it should be natural, but we have all started running towards sleep, and some people push away sleep. There are principally now just 4 stages of sleep: stage 1, 2, 3, and REM sleep. Stage 1 and 2 are light sleep, stage 3 is deep sleep. We don't need to know the semantics of it, because once you go and start looking at your Apple Watches or the sleep cycle, people get more and more worked up about it. That's my opinion. So I don't think those things help. In the initial half of the sleep, or initial first half of your sleep, you would cover 70% of your sleep. This will have a lot of deep sleep. The second half of your sleep, you will only be covering 30% of your remaining sleep. So it is harder to wake people up in the initial or first half of sleep, and it is easier to wake people up in the second half of their sleep. So that in nutshell is sleep. What people forget is, we've all learned since we were children, jaldi so, jaldi utho. And in my opinion, that is the thing that has done the most damage.
Yes.
Because the principle is, jo jaldi uthta hai, wo jaldi sota hai. People wake up at 9 o'clock, 10 o'clock in the morning, and they expect to sleep around 10. And that will not happen.
Yeah.
So we will talk a little bit about sleep cycle as well, and we'll tackle it as the questions come in.
Sure. So, would you like to touch upon there are some common sleep disorders such as insomnia and sleep apnea and restless leg syndrome, because we have a lot of questions around these three, key disorders. So, I would request you to touch a little bit upon this and explain why this happens and, how it can be prevented.
So essentially, sleep problems can be categorized into 3 things. Insomnia, which is either difficulty in falling asleep or staying asleep. Secondly, hypersomnia, नींद ज़्यादा आती है. And third is parasomnia, funny things happen in sleep, like sleepwalking or sleep talking. So insomnia, we all know, नींद देर से आती है या जल्दी खुल जाती है या टूटी टूटी नींद आती है. So that is all part of insomnia. Hypersomnia, जब नींद बहुत ज्यादा रहती है, पूरे दिन नींद आती रहती है. Then we start talking about quality of sleep, right? So people go towards quantity of sleep and they do not focus on quality of sleep. So sleep apnea, restless leg syndrome spoil the quality of sleep. So that's why, we feel tired through the day or sleepy throughout the day. And of course, parasomnia, restless legs, you can put in parasomnia also. Restless leg syndrome is a very specific medical condition. Generally happens because people have either anemia, right? So they're short of iron, or as a side effect of certain medicines that they might be on.
Okay.
So restless leg syndrome is a very medical condition, and there are multiple reasons for it.
Right.
Sleep apnea, specifically, we're talking about obstructive sleep apnea.
Yeah.
Right? Yeah. So obstructive sleep apnea happens generally seen in people who are a bit obese. Their breathing route in the night gets compromised. So they
Right.
don't get enough breath at night. So the brain tends to keep on waking up again and again. It is not dangerous, but you don't feel fresh in the morning.
Right.
People with obstructive sleep apnea generally are snorers and overweight and are more prone to having problems like depression, concentration issues, and anxiety.
Okay. Okay. So, if like there are people, I'll just take some questions in between because so that we can also try to answer some of these questions. So, like somebody is saying, I have been taking some form of sleep medication for the last 20 years. I'm 75 today. And still, in spite of all this, I don't get enough sleep.
So I'll draw a diagram for people,
Sure,
right?
sure.
So there's a very universal formula for sleep, and I'll just write it as it should be.
Okay, okay.
I hope people can see the board.
Yeah, yeah.
For a good sleep, only two things are necessary: body and mind. The
Okay.
body needs to be tired, and the mind needs to be relaxed. Right? That's it. So that's how people sleep. They tire their body in the day, and the mind is relaxed. You will automatically sleep. But more and more people we see, they come with this problem. So the body is relaxed, we don't exercise, and mind is tired. So there are things happening in the mind, or you're thinking about things. And in fact, even if you think कि नींद आएगी या नहीं आएगी, तो नींद नहीं आएगी. Right? So we are expecting good sleep, कि नींद आनी चाहिए, आनी चाहिए, आनी चाहिए, but we don't do enough for us to expect or deserve a good sleep. Right? So as far as possible, we should try and come back to the formula. Body must be tired or should be tired, and mind should be relaxed. And that's how we sleep. Now, the gentleman who's talked about sleep problems and they've been on sleeping tablets for 20 years, it's very easy to write sleeping tablets. It's very difficult to get people off them. There is also this expectation of 8 hours of sleep per night. Right? So this 8 hours is a myth. As we grow older, the body gets more and more, or the metabolism slows down. So we need lesser sleep. So we might appreciate that a newborn baby might sleep 20 hours a day. A school-going child will sleep between 10 and 12 hours. Later on in school and college, children might sleep 8 hours. Working age professionals, 6 to 8 hours. And as you grow over 60, 4 to 6 hours, even 6 hours is more than sufficient. Right? But our expectation remains still that I should get 8 hours of sleep. I don't think that is feasible. So you will always be discontented with your sleep.
Yeah, I'm
Right?
for
Because,
sure discontented.
sorry?
I said I'm for sure discontented because I can't sleep more than 6 hours.
Because we want our 8 hours of sleep, because everywhere it says we should sleep 8 hours.
Yeah.
Right? But 8 hours is a myth. It does not work like that. Sleep should be a range. Right? So 6 hours, if you're sleeping, that's enough. And again, I go back to the point. It is all about the waking up time. You don't choose a sleeping time, you choose a waking up time. And your sleeping time is 6 hours before you wish to sleep. For people who are over 60, and for people who are in working age professionals, 7 hours before their sleep time, before their wake up time. So focus on the wake up time rather than the sleep time.
Okay, good. So there's a question on how is metabolism related to hours of sleep?
So as I said, anything over 6 hours, around 7 hours is more than sufficient. Right? We know people who sleep less will have difficulties with metabolism. They will have less energy levels, right? Because as I said, body repairs itself when you're sleeping, right? Certain chemicals go up, certain chemicals go down. But if your sleep cycle is disrupted, right, and we specifically say people who work shift system, it is incredibly hard for them, right, because the body does not get that opportunity to heal itself, right? So if you're not sleeping well, the whole of body suffers. As we said initially, whether it is your physical body or the mental body or the mental health, both of them struggle. Everywhere the struggle is.
So I'll take a couple of other questions related to sleep. What people have said, like I take my night sleep in intervals from 10 p.m. to 2 a.m. and then from 4 a.m. to 8 a.m. And I also have PCOS. Please tell me, will this affect my sleep schedule?
So funnily enough, about 200 or 300 years ago, there was a concept of first sleep and second sleep. So people will sleep for some hours, then do their work, and then they sleep again. So perhaps she's following the same principles. Uh, it's okay. I mean, we would prefer if it is 6 or 7 hours in a stretch rather than broken 4 hours, right? It also means there has to be something that they have to do. That's why they wake up, or they've got into a very bad pattern. Right? Now, whatever habits or patterns you break, it takes some effort. Right? You have to go through a little bit of difficulties to change a pattern. Right? So we would prefer if it is 6 or 7 hours at a stretch rather than these two chunks of 4 hours. But in history, there were times when people would sleep this way.
And one more question related to this, doctor, is, and this, I am also a victim of this. So it's about, when you wake up in the middle of the night, then it's very hard to go back to sleep. So, for me, it is like I start thinking about all the problems I have to solve in the bird.
Yeah.
And then I just lose my sleep.
So, but look, it depends what time you slept. Right? There are people who sleep at 9 and they wake up at 3 and then they're unhappy. कि बाकी लोग तो सो रहे हैं, हम उठ गए. आप इसलिए उठ गए, आपकी नींद पूरी हो गई. Right? बाकी लोग आपसे लेट सोए होंगे. Right? So, take a sleep cycle or timing that you like, right? Whether it is 11 to 5 or 1 to 7 or 12 to 6, it's entirely up to you. Right? I also tell people, generally people come with saying that insomnia is a problem. And I would say to them, insomnia is not the problem. There are other things happening in their life, and insomnia is a symptom of that problem.
Right.
Solve that, and the sleep will be okay. Right? So people may be going through depression or anxiety or some lifestyle challenges, whatever it is. So people think that insomnia is the disease, but we tell them, look, insomnia is a symptom of some other disease. आप उसको ठीक करोगे तो नींद अपने आप ठीक हो जाएगी. But people focus just too much on that sleep.
Right. So is there any way to stop that thought process, once you wake up in the middle of the night or even like at 4 o'clock for whatever reason, and then you want to go back to sleep, but it's just that you have become too awake now to fall back into sleep, so is there any tip for that?
Look, you have got a thing written behind you. Mental health it's a, what does it say?
It's a journey. It's not
a journey. Having a good sleep is a journey, not the destination. So again, look, when people say I want to sleep or I try to sleep, that is where the sleep problems will start. Right? If you're woken up and if you can't go back to sleep, leave your bed. There's no point fighting it out because your thoughts will even become more and more. You'll get even more anxious about it. Right? So if it's 4 o'clock, you can't go back to bed, leave your bed. Right? Maybe your body wants 10 to 4 cycle. Right? And at 5 o'clock, go for a walk. Right? But you have to do more. You have to be creative in what you can do. Right? As long as you're completing your 6 hours, then I'm satisfied as a doctor.
Okay. No, wonderful. Jayashree, do you want to add anything here?
Yeah, I think that's something which we've all experienced at some point when we get up in the middle of the night and we're fighting that, we're constantly checking ourselves that have we fallen asleep.
Yeah.
It's counterintuitive. If the more you're thinking about how you're, whether you're sleeping or not, you're actually keeping your brain totally active, which is the complete opposite of what you do when you're sleeping. So as doctor was mentioning that, it's difficult to fight that urge to constantly check whether you're falling asleep or not. But that's the time when you need to actually tell yourself you have to get out of the bed, do something, do anything.
Something.
Again, that'll make the diagram that Dr. shared is absolutely, keep that in mind, I think. Relax, feel tired, and let your mind relax. And that's when that sleep will come again.
Absolutely. So I have a Hindi ka muhavra. Some people might relate to it, some people may not. And it goes up, रेते और पानी को जितना जोर से मुट्ठी में पकड़ते हैं, उतना हाथ से सरकता है. So sleep is exactly that. The more you run towards sleep, the more it runs away from you. Right? So whatever we get is bonus.
Very well said. Very well said. So now I would actually like to touch upon, I'll request you to touch upon the neurological impact of, sleeping problems. And if you could talk and explain that a little bit more, that would be nice.
Yeah, so as I said, there is no part of the body that doesn't get affected if you're not sleeping well. Now, the definition of well can be different in my terms and your terms, but almost everywhere we get affected, right? So we were talking about neurological things. So you are expected to have more memory problems if you're not sleeping well, right? Of course, things like depression, anxiety, they're very complex phenomena. They're not as straightforward as chemical imbalance. Okay. So people who are not sleeping well are expected to have more of depression, right? We can't really say people can actually develop, neurological illnesses, but again, there are more chances of having stroke, heart disease. They also impact, the neurons in the brain. So having a good sleep is important. Now, some of people or some of the symptoms where people are oversleeping, that could be symptom of, some neurological diseases, right? So sleep palsy, so those sorts of things. There are people who just fall asleep like that, sleep paralysis. So all those are symptoms of people who have oversleeping tendencies or hypersomnia they have.
So, doctor, if you can't sleep without the help of the medicine, what should we do? Keep on having medicine? Or what should we do?
So again, as I said, we have to look at the reason for not sleeping well, right? That is where it starts from.
No
right?
reason.
Actually, hota hai. So it may be small in your mind, but hota hai. See, once you start on medicines, it is incredibly hard to get off them, right? You have to tire yourself out. When you stop medicine, you have to say, okay, 5-7 days may not be the best. Then the sleep will start coming back in. And keeping us, sorry?
Sorry, doctor, it's not helping me. It's
No, I'm coming back to that. I'm coming to that. Now, if you have a standard waking up time, a fixed waking up time, that is the single most important thing that can help people, right? Also accepting that, look, 6 hours is fine, right? So if you wake up at 6, you're likely to sleep around 12, right? What most of the people say, हम तो पहले 9 बजे सोते थे, हम 10 बजे सोते थे, but पहले हम active भी ज़्यादा थे, right? So we will take a sleeping tablet at 9 o'clock or 10 o'clock to sleep, but that is not matching your sleep cycle. So even the medicines may not help that much. When people keep on taking sleeping tablets, तो उनका असर तो खत्म हो जाता है. People become tolerant to the effect. But then there is only that psychological effect that remains. I have taken medicine, so I will sleep. और अगर दवाई नहीं ली है तो नहीं सो पाएंगे.
So there is
So,
sorry, go
mm,
ahead.
go
Please
on, go on, go on. Mm.
I hope, ma'am, we have been able to answer your question. And um, so there are a couple of questions, Dr. Vipul, which are related to people who are working in night shifts. And what is it that they need to do to maintain their sleep hygiene? Because I think we have 3-4 questions like this. People who are either working in US shifts or factory shifts. I don't know what.
So, there is a world leader. He's an Indian in circadian rhythms. So, circadian rhythm is the body clock. एंड वो कहते हैं कि जो लोग शिफ्ट वर्क करते हैं, जो लोग नाइट शिफ्ट करते हैं, उनकी सोसाइटी को पूजा करनी चाहिए, बिकॉज दे आर पुटिंग देयर बॉडी थ्रू हेल इन अ वे, बिकॉज द बॉडी इज नॉट रिपेयरिंग इटसेल्फ. If you have a fixed working time, that is still okay. But if you have a shift system, then you're going to suffer a bit more. Because as I said, you can choose whatever time you sleep and wake up, but it has to be consistent. That consistency is the key. So people who typically work US times, so say for example, they might sleep 6 a.m. till 2 p.m. Right? That's okay. Right? But people who work, okay, some days it's 12 to 8 in the night, some days it's 8 to 2, the other person is working 2 to 10, and it just keeps on shifting. They tend to struggle more. So if somebody, works US shifts, then having a quiet place to sleep with no noise, right? Because the rest of the family is waking up. Having curtains which are completely, darkened, right? Blackout curtains, they help. But stick to your consistency, hopefully over the weekends also. It's when you keep on changing and swapping, that is when you struggle more.
Right, right. And there are, there is a tendency in elderly, to just pop in a sleeping pill, just because I think it is so freely and easily available in India that I think they discuss with each other and they say, oh, I just have an Alprex and go to sleep. And then I think, can you talk about, and there are a lot of questions which we have that despite taking sleeping pills, I'm not able to sleep. So I think if you can just touch upon this and also educate our audience on the side effects of, this.
So it is convenient for both parties, right, to prescribe a sleeping tablet, the doctor as well and the patient as well. क्योंकि किसी की मेहनत नहीं लगती फिर, right? So, otherwise you are telling your patient to exercise करनी है, time manage करना है, sleep cycle समझानी है, right? So it is easy to give a sleeping tablet. It is also easier for the patient कि हमने गोली खाई और सो गए. Right? We don't need to change our lifestyle. We don't have to make any changes in our day. We take a tablet and sleep. Now, sleeping tablets are very addictive, right? And there is something that we call as tolerance develops when people take it for longer. So generally, whatever dose of whatever sleeping tablet you take should not be prescribed for more than 28 days, because after that, the tolerance starts developing in the body. So for the same effect, you need more dose, right? So for example, people who do not drink any alcohol, if they have one shot or one drink, they will get intoxicated. If they keep taking one every day, then they'll need 2 for the same effect. If they keep taking 2 every day, then they need 4 for the same effect. So that's how the medicine works, right? You become tolerant to it, and then the dose keeps on going up. And you might feel, okay, the medicine has stopped working. Right? Because your body has become tolerant to it.
Okay. So there is one question about, difficulty in falling asleep due to body pain or waking up in the middle of the night due to, pain in the, in your back or in your side, hip joint pain, like a lot of people complain about that. So how would you like to?
Again, we have to look at the condition. Sleep is only a symptom, right? If you have sciatica, you have there's something called periodic limb movements in sleep. right? So we have to look at the condition. Then only we can solve it or sort it. Giving a sleeping tablet is not an answer, right?
Yeah.
So if you have a back pain, you go to a physiotherapist, you meet a neurologist, जो भी medicines हैं, you take to sort the back pain out. Sleep will come automatically.
Okay. Okay.
Archana, there's one question that's come. Since we get vitamin D from the early morning sun rays, how do people who get up late in the day around afternoon manage that? I mean, I don't know if this question is perhaps in relation to someone who's working in a shift work or something.
Look, I'm sorry, but I'm not aware that you can only get it in the morning sun, right? So I think you will still make it if you're in sun. People can walk after lunchtime, right? So people can, chutti wale din people can walk. But the science for me is a little bit confusing because people who are in sun all day are also vitamin D short. So I can't give a better answer. But if you have an opportunity to walk, be in the open, then you should take it.
So, the youngsters today are, they boast about how many Netflix shows they can see during the night. And I think for them, it's almost like peer pressure that if they don't stay awake till 2 a.m. in the night and do all their socialization, they will not be in the in thing, So I think it'll be good to, help understand the long-term effects of this, because sometimes I'm jealous of them that how are these people awake till so long, But I know that we never did this, but this generation, the younger people, I don't know where they get that energy from to prolong their sleep
No,
cycle.
but either they sleep longer, right? So in the morning, they will wake up late, right? Or they will have no energy in the day, right? I recently came across a word which is revenge bedtime procrastination.
Okay.
I don't know if you've heard of it. So this means people who have a really stressful job, right? They feel कि मेरे को तो अपने लिए time मिला ही नहीं. So let me watch and do things before I sleep. I need 2 hours and they cut it from sleep. So they push away sleep, then they're tired in the morning, they can't concentrate, they might be irritable. But a healthy mix in life is important, right? And sleep, should be secure, 6 hours, 7 hours. I think that is enough.
So is the saying early to bed, early to rise makes a man healthy, wealthy, and wise still applicable? Or
Well,
that?
but it should be, right? So, I was talking about that person who's very, his name is Dr. Sachin Panda, the leading world expert in circadian rhythm. He says electricity has done a lot of damage to us. Yes, there are benefits out of it, but pre-electricity time, everybody will sleep, right? Because there is no light, right? And then you'll wake up as soon as the day breaks because you have things to do or get things to be done before the dark comes. Since the advent of electricity, we have discovered, we can have more time in the evening. Right. And that's why, the sleep is, getting cut as much as, people can push themselves, they push.
Right. Yeah. So if, there's also this, there's this, I keep reading about sleep rituals, people, there are so many tips out there to how to prepare yourself for sleep. So, would you like to share your tips for how to get a good quality?
Okay. So I'll tell you 7, 8 things that I think really help people. Okay. Right. And again, when I tell this, I say it's a work in progress. Right. So you might feel that it's not working for you, but still continue.
Please.
Number one, right, is always waking up at the same time. Right. This is especially for people
there is a request कि आप tips को हिंदी और इंग्लिश दोनों में बता देना.
I'll do that. I'll do that. So number one is having the same waking up time. This is even more important for people who have sleep issues, right? So generally people with sleep issues will come and say, हफ्ते भर में तो नींद आती नहीं है, weekend पे we are going to sleep, right? That does not help their sleep cycle. तो same time उठना है. Your body will tell you कि अब सोने का समय हो गया है अपने आप. आपको सिर्फ उठने का समय तय करना है. That's number one. Number two, कभी भी लेट के नींद का इंतजार नहीं करते हैं. जब नींद आती है तब जाके लेटते हैं. क्योंकि अगर आप लेट के नींद का इंतजार करते हैं तो फिर कल क्या होगा, आज पूरे दिन क्या हुआ, अगर सोएंगे नहीं तो कल का दिन खराब हो जाएगा. आई मस्ट स्लीप, आई शुड स्लीप, आधा घंटा हो गया नींद नहीं आ रही. So those sorts of thoughts start coming back in, right? So go to bed when you feel sleepy. अगर आपको लगता है लेट के नींद चली गई तो बेड भी छोड़ दीजिए. लेट के नींद से भिड़ना नहीं है, ठीक है? चाहे कितनी भी देर नींद आए, ठीक है? That's okay for that night. Next day we start again. ये नहीं करना है कि कल रात कब नींद आई थी तो दिन में 2 घंटे सो लेते हैं आज. बिकॉज अगर आप दिन में सो गए तो रात के घंटे कट हो गए, फिर यू विल गेट इनटू अ इवन वर्स स्लीप साइकिल. नेक्स्ट, सम पीपल हैव a turn down or a sleeping routine before they want to sleep. So generally what we say कि 1 घंटा पहले, 2 घंटा पहले, जो भी आपको लगता है, आप अपने स्क्रीन से दूर चले जाते हैं, ठीक है? जितनी लाइट कम हो उतना अच्छा है. येलो लाइट हेल्प करती हैं. लाइट्स व्हिच आर पॉइंटिंग डाउन, दे आर बेटर देन पॉइंटिंग अप. Some people may want to do meditating, some people might want to do journaling, कुछ लोग थोड़ा पूजा करना चाहते हैं, कुछ लोग अपना फेवरेट कैंडल जलाना चाहते हैं, कुछ लोग अपना फेवरेट म्यूजिक लगा लेते हैं, राइट? एंड अगेन ट्राई डिफरेंट थिंग्स. अगर आपको पता नहीं है आपको क्या सूट करेगा, राइट? यू मे वांट टू राइट about how your day has gone and what is the plan for tomorrow, ताकि वो सब चीजें यहाँ पे ना रहें, right? So that your brain is assured कि भूलेंगे नहीं, कल याद रहेगा, right? So anything that calms down the mind. सोने से 1 घंटा पहले कुर्सी पे बैठ जाते हैं, read a book or listen to your favorite music, and जब नींद आती है तो बेड में चले जाते हैं. कोशिश करते हैं कि शाम को 5-6 बजे के बाद टी कॉफी नहीं लेंगे, राइट? आप जितना लेट टी कॉफी लेंगे उतना ही वो नींद में इंटरफेयर करेगी. इफ यू एक्सरसाइज लेट एट नाइट, दैट आल्सो विल डिसरप्ट स्लीप. क्योंकि जब एक्सरसाइज करते हैं तो एड्रेनलिन रिलीज होती है बॉडी में, व्हिच वेक्स अस अप. लॉट ऑफ यंग पीपल गो टू द जिम लेट इन द इवनिंग एंड दे टेक कैफीन एंड प्री-वर्कआउट, वो सारी चीजें जिसमें कैफीन भर भर के होता है, तो उससे तो नींद और पीछे चली जाती है. And a little bit of exercise, whatever you can do, is important. As we said, the body has to be tired, तभी सोएगी, right? सिर्फ कह देने से मुझे सोना है ऐसे नहीं होता. And we also adapt to the changing circumstances in our life. राइट? आपका ये कहना कि हम हमेशा तो 9 बजे सोते थे, ऐसा नहीं है. हो सकता है आपका वेकिंग अप टाइम चेंज हो गया अब, राइट? सो बी ओपन टू चेंजेस, चैलेंजेस, अडेप्ट करते हैं. बट अगेन, हम जितना नींद के पीछे भागेंगे, नींद हमसे उतना ही दूर चली जाएगी. इट शुड नॉट बी अ स्ट्रगल टू स्लीप, ठीक है? एज लॉन्ग एज आप कहते हैं जितना आएगा खुश है, तो बच्चों की तरह सोएंगे.
Wonderful, wonderful. Thank you for sharing that. There are a couple of more questions which are coming in my direct chat. So one question is around, what do you think is the reason for palpitations post 1 hour of sleep?
So again, it is part of something else. It has nothing to do with your sleep, right? Maybe you are anxious, right? Maybe you have things going on in your mind, right? But it is not a sleep issue per se. It is a symptom of something else.
Okay. Dreams and sleep. What do bad dreams indicate? I know we are going this, it's a very big topic, but
No, I have only 2 words to say, 4 words to say. जैसा मन वैसे सपने. If your day has been good, if your mood is good, your dreams will reflect it.
Mhm.
If your day has been rubbish, things have been going on, your dreams will reflect it too.
Okay. Okay. Great. Great.
मुझे भी कुछ पूछना है।
हाँ जी मैम पूछिए।
मैं कितने भी बजे सोऊं, मेरी आंख 3 बजे खुल जाती है और उसके बाद 5 बजे तक लड़ाई लड़ती हूँ कि अब आ जाए, अब आ जाए, अब आ जाए, और फिर 5 बजे सोने के बाद फिर सुबह 8, 8:30, 7 इस तरह से खुलती है, तो रूटीन सारा खराब रहता है और बॉडी भी रिलैक्स नहीं होती है। ऐसा
अच्छा,
क्यों?
देखिए, जो हमारी मेडिकल भाषा में आप जितने बजे बिस्तर छोड़ते हो वो आपका वेकिंग अप टाइम है। तो मेरे हिसाब से तो आप 8 बजे उठते हो। ठीक है, आप खुद ही बोलोगे आप बेड में तो 10 घंटे रहते होंगे शायद।
नहीं, 7 बजे
तो
तक उठ जाती हूँ।
हाँ, तो जो आप बेड छोड़ते हो 7 बजे, ठीक है, तो फिर मेरे हिसाब से आप 12-1 बजे थोड़ा सा अपना सोने का समय को पुश करिए पीछे।
ठीक है, ओके।
ठीक है, या जो आप दोबारा सोते हैं उसको छोड़िए, ताकि
हाँ,
ब्रेन को समझ में आ जाए इतना ही सोने का समय है, या तो पहले सो लो या लंबा सो लो। लेकिन जो आप दूसरी अपॉर्चुनिटी देते हैं तो बॉडी का स्लीप स्ट्रक्चर खराब हो जाता है, एक बैड हैबिट में चले जाते हैं।
ओके। तो 3 बजे आँख खुल जाए तो 3 बजे ही उठ जाए।
आप बेड छोड़ दो, 2-4 दिन में आपका ब्रेन अपने आप ही आपको 4-5 बजे उठाने लगेगा।
ओके, थैंक यू।
I have one question.
Yeah. May I know your name?
Please.
Preeti. Okay.
I was just wanting to find out what is the role of the subconscious mind in the sleep, like how important it is.
Yeah, so look, the part of the brain that we understand is only 5%, right? So आप उसको conscious mind बोलते हो. The rest of it is subconscious or unconscious. Everything is happening in that unconscious mind, right? You may feel कि हमें तो इसका डर नहीं लगता है, हम उसके बारे में सोच नहीं रहे हैं, but it all adds up. So when we talk about feeling relaxed, we're feeling the whole body is relaxed, not just the conscious mind कि आज हमने काम नहीं करा तो आज हम relaxed हो गए, right? तो
Right.
आपको lifestyle changes लाने पड़ेंगे अपने लिए, तभी वो unconscious mind भी शांत होगा.
Yeah, because you really don't know that your mind is, working and thinking all the time, or like, you're even trying to solve your issues maybe at night when you're not getting sleep. And sometimes you don't know whether because you don't feel that your subconscious mind, I mean, I am not having a thought which I know that, okay, this is troubling me, but still you don't get sleep.
Yeah.
So, how can you really identify, like you said, that there is a problem, that's why there's no sleep, right? So you need to
Yeah, so
identify the problem.
there has to be, there are only two things, right? There are some things happening in your life that are not allowing your brain to switch off.
Yes,
And number two, आप अपनी sleep cycle से पहले जाके लेट जाते हो. See, हम लोग, we are ordinary people. We can't have an empty mind. If we are awake,
yes,
some thoughts will come. मन अच्छा है तो positive thoughts आते हैं, मन खराब है तो negative thoughts आते हैं, right?
yes,
It can only be these two things.
okay. And how much do you think is the role of, like, sometimes it happens that, what you said, jaisa man
Hmm.
this, while you sleep right now, you said. So it does happen, like, that, sometimes you are, watching something at night, a bad movie, or, like you said, to television, Netflix and all that. So, like, how much role do you think that would have on a person, or it is like a person to person, something like that?
It's a very person to person thing, right? So, some people like horror genre as something that they
Yeah,
watch.
yes,
So I know it is not
yes,
for
yes.
me. मैं रात को ऐसी कोई चीज देखूंगा मेरे सपने में जरूर आएगी, right? So it is a very person to person
So it's
thing.
a very person.
And but what we normally suggest is कि सोने से 1 घंटा पहले तो बंद कर देना चाहिए स्क्रीन.
Yeah, true. True. Okay. Okay. Thank you. Thank you.
There's one more question that some people, sleep well in front of the television, and once they go to their bed,
Yes.
they
Yes.
sleep.
Yes.
Ah,
So, what do you have to say to advise such people?
okay. So two things only. So पहला तो ये है that television sometimes works as a distractor of thoughts. कि ठीक है मेरा मेरा ध्यान वहां पर है तो अपनी प्रॉब्लम्स की तरफ नहीं है, so I will sleep. Right? Second, we talked about being hyper vigilant about sleep, यानी नींद की चिंता करना. So we all have a relationship or a mental relationship with the bed. So for example, I'll tell you, I don't get much opportunities to sleep. So as soon as I lie down, my brain realizes यही सोने का समय है, तो सो जाओ. Right? But people who watch or work while sitting in bed, that relationship does not work because the brain can't comprehend लेटना है, सोना है, क्या करना है. Right? And second, if we become scared of sleeping, तो होता है बेड में जाएंगे, पता नहीं नींद आएगी नहीं आएगी, तो मोस्ट लाइकली नींद नहीं आनी है. बट बॉडी तो टायर्ड है ना, उसको तो सोना ही है, तो जहां अपॉर्चुनिटी मिलती है सो जाता है.
Okay, no, that's a very common phenomenon I've seen in elderly, especially, like they like to when like my mother, I'll see her sleeping all the time, but then when I tell her to go to sleep, she says, no, मैं तो बिल्कुल ठीक हूँ, I'm not. नींद नहीं आ रही है. So one last question I'll take, and then I think I'll request Jayashree if you can come in and also summarize and bring in your thoughts. There is a question about why do people feel more tired after a afternoon nap sometimes? Because I know that in some cultures, even in India, there are people who there's a siesta time, like in Goa, for example. There is this I'm forgetting the name, but they have this designated time for going to sleep in Spanish
Spain
culture.
and Italy. Yeah, Spain and Italy still have that. Yeah. So if you are sleep deprived at night, you might get into deep sleep in the day, right? And as I said, initially, आपके जो initial half of sleep है, उसमें उठाना मुश्किल होता है. But आप second half of sleep में किसी को उठाओ तो it is easier. So perhaps you're being woken up from a deep sleep. So that is why you're tired. Right? People who take, cat naps in the afternoon or, what's the word for it? Power naps, right? They're not deep sleep, right? They're very superficial sleep, but it just takes our mind off things. You just tend to feel a bit relaxed. But अगर आप deep sleep में चले गए, उससे उठ रहे हो, then you feel more tired.
Okay.
Archana, just one sec. Can I have one more question?
Yeah, I'm sorry. Yeah, please go ahead.
Please, yeah. Actually, while I was talking about the subconscious mind, actually, I had come across this therapies like hypnotherapy and all, where you can just train your mind, subconscious mind, with the thought of getting sleep. So, do you think something like this really works?
Yeah, in fact, that was my question, that how does counseling or therapy help, with sleep?
Yeah.
Yeah, so look,
Okay, I probably missed that. Okay.
So if you are filled up till here, then of course you can't sleep because things are just going on in loop in your mind. ये करना है, ये हो गया, अब कैसे होगा? When you're in therapy, right? Some of these things are being expressed, right? So that pressure is reducing. You might also get pointers about managing your stressors, adding the relaxation, or some motivation tips भी मिलते हैं. So then it helps because again, as I said, do not take sleep as an illness. It is a symptom of generally of something else.
True.
Focus on that something else. If you sort that something else, sleep will come naturally. You don't have to fight for it.
Definitely.
Thank you, doctor, for answering that.
Thank you.
Jayashree, would you like to come in and
Hello.
share any summarizing thoughts, and then before we kind of wind up for the day, and also I'll request Dr. Vipul to just save a couple of tips for the end, sir. So, Jayashree.
मुझे भी कुछ पूछना है
हाँ जी मैम,
हाँ जी।
Also wanted to ask.
सर मुझे ना रात में बात करने की आदत है। मैं रात में बात भी करती हूँ, चलती भी हूँ और कई बार खाना भी खाती हूँ। मैं जब पानी पीती हूँ तभी मेरी नींद खुलती है। ऐसे मुझे कुछ नहीं पता चलता और ये 6-7 महीने से रोज हो रहा है।
सो इसको पैरासोम्निया बोलते हैं। फनी थिंग्स हैपन इन स्लीप, राइट? जनरली आपको या तो बहुत डीप स्लीप नहीं आ रही, या मसल्स जो रात में रिलैक्स होने चाहिए वो नहीं हो रहे, राइट? जनरली अगेन वी विल आस्क यू टू थिंक कि भाई लाइफ में क्या चल रहा है। आप कह रहे हो पिछले 6-7 महीने से ही आया है, राइट?
हाँ,
सो
मैं
अगर कुछ स्ट्रेस है, ज्यादा टेंशन में है, तो ज्यादा पता चलेगा, ठीक है?
मैं 2
देखिए,
साल
थोड़ा सा
से
आपका बेटर आंसर करने के लिए आपकी हिस्ट्री और जाननी पड़ेगी।
सर मैं 2 साल से डिप्रेशन में हूँ। मैं डॉक्टर की दवाई भी ले रही हूँ। मुझे दवाई खाने के बाद से ही ये 6-7 महीने से ऐसा प्रॉब्लम होने लगा है। अभी
तो
मैंने
देखिए
2 हफ्ते से दवाइयाँ बंद कर रखी बट मेरे को फिर भी हो रहा है।
अच्छा, देखिए मैं आपको ना बहुत पर्सनल वाले राय तो मैं नहीं दे पाऊंगा, बिकॉज आई नीड टू नो मोर आपके लिए, ठीक है? बट जनरली मेडिसिन कुछ होती हैं दवाइयाँ जिनसे नींद आती है, कुछ दवाइयाँ होती हैं जिनसे नींद चली जाती है, कि कुछ दवाइयाँ अलर्टिंग होती है, एंड बहुत सारी ऐसी दवाई होती है जो औरों के लिए अलर्टिंग है, कुछ लोगों के लिए सीडेटिंग हो सकती है। सो देखिए, आपका केस मैं आपको बहुत ज्यादा इस समय नहीं बता पाऊंगा, बिकॉज जब तक सारी चीजें नहीं पता, इट इज अ लिटिल हार्ड टू आंसर दैट क्वेश्चन।
ओके।
So you can reach out to Samvedna if you want to consult Dr. Vipul, and we'll help you get an appointment. So
May I please ask one question?
Sure, ma'am. We have just about 5 minutes left.
I'll just take not even a minute. I
Okay.
just wanted to ask the doctor.
Can I
Is
get
there
your
any
name?
correlation? Yeah, I'm Jyoti Mehta.
Okay.
I wanted to ask the doctor, is there any correlation between, what I have observed is as people grow older, so the ones who are very active, they keep their brains active with positive activities. Their the sleep time tends to go down, and the ones who are, going into a slight dementia or something, or Alzheimer's, they tend to sleep more. Is it true? Is there a correlation?
See, sleeping also becomes a time pass for people, right? Because you don't have much better to do. So people tend to lie down more, right? So people, let's say, who are less active, how do they pass their time? So they would all go and lie down more in bed. People who are active, they have things to do. Adrenaline is releasing in the brain. They will be more active. They will need lesser sleep, right? But they will still manage their 6 hours के आसपास की नींद, somewhere between 4 and 6 hours.
Yeah, okay. Fine. So, right. So it's better to remain active.
Absolutely.
Great. So we are completely run out of time, and so Jayashree, would you like to just come in and summarize this? And as a therapist, as a psychologist, would you like to add any other points to this?
No, I'd like to thank Dr. Vipul for sharing all these great tips and insights and answering all these questions. I mean, I just want to kind of reiterate that what you mentioned about the tips for good sleep, trying to wake up at the same time every day, following some sort of a routine before you get into bed, whatever that routine means for you, and that's really, really important. Not looking at your devices before you're getting into bed. That's a very hard one for a lot of people, but that's a very critical one. And I think we can, maybe do another session just talking about the challenge of actually doing that. It's easier said than done. If doing some amount of exercise so that your body feels more tired, your mind becomes more relaxed. limiting any sort of, tea, coffee, a couple of hours at least before you go to sleep, so those effects don't impact your sleep. So I think all of those are really, really important things. And one of the things that doctor's been highlighting repeatedly is that sleep is like a manifestation, sleep issues are really a manifestation of some or the other kind of problem. Sometimes we don't even know what those issues are. That's where if you speak to a counselor, it sometimes helps to identify some of those stresses, just get those thoughts out of your subconscious mind, perhaps, identify those issues and challenges. And just a quick parting tip, I think, is sometimes, a lot of people say they wake up in the middle of the night, chinta ke saath. One of the things that I suggest is that they just get up and they write that down then, so that it's there till the morning. You can address it tomorrow morning. So, but we can, I think it's very important that if you're really struggling with your sleep, again, reach out to someone, and try and understand what solutions might be there for you to help you deal with this better and make yourself feel better about sleep. As doctor was mentioning, it's supposed to be something that's very natural. So if it isn't happening naturally for you, then let's find out, approach a professional, try and understand what we can do to help you sleep better.
Right. No, thank you, Jayashree. Thank you for summarizing that. So, Dr. Vipul, any last 2 tips or anything you would want us to think of and sleep well today and, be happier tomorrow?
So I'll finish with an analogy.
खराटे वालों के साथ कैसे सो सकते हैं?
तो देखिए ना, खराटे प्रॉब्लम है उसको सॉर्ट आउट कराइए, राइट, ताकि आप ठीक से सो सके. देखिए, I have an analogy of human body with sleep, with mobile phone, right?
Okay.
So हमारी बॉडी बिल्कुल एक मोबाइल फोन जैसी चीज है, राइट. और नींद का जो काम है वो उतना ही है जितना इलेक्ट्रिसिटी डज फॉर आवर फोन, इसको चार्ज करना, राइट. सो द बॉडी चार्जेस द फोन जस्ट लाइक बिजली फोन को चार्ज करती है. अब आप अपना फोन दिन में चार्ज कर सकते हो, रात में कर सकते हो, टुकड़ों में कर सकते हो, या एक साथ कर सकते हो, उसको तो फर्क नहीं पड़ता, राइट. अगर अपने फोन का इस्तेमाल नहीं करेंगे तो 3-4 दिन चल जाएगा बिना चार्ज करे हुए. लेकिन अगर ये 100% चार्ज हो गया है तो 200 कभी नहीं कर पाएंगे इसको, राइट. तो इट इज अप टू यू टू फॉलो अ गुड स्लीप साइकिल, वॉट एवर यू लाइक. बट अगर थकाएंगे नहीं तो अच्छी नींद भी नहीं आएगी.
Very well said. Very well said. Now I think it's crystal clear to me, at least, that how to power myself, and overpowering is also not going to help because charge to utna hi hoga. No, thank you, Dr. Vipul, so much for your time. And for all our audience, this is available on YouTube. You can view it there. It will be there, the video, and we'll also share the recording in the email, which we'll be sending out post the webinar. And in case you would like to reach out to us for any support in terms of taking a consultation with Dr. Vipul, or availing any counseling services from Samvedna, we work with all age groups. We specialize in elderly mental health issues, but we also work with adult population. So please don't hesitate to reach out to us and seek support for the problems here, which might be impacting your sleep. So I wish everyone a good night's sleep today. And thank you, doctor. Thank you for coming in and sharing your valuable tips.
Thank you.